Hi, my name is Hemant Reddy. I'm an orthopedic surgeon with SCOE. I specialize in hip and knee replacement surgery.
What is a periprosthetic fracture and when does it happen?
A periprosthetic fracture is a fracture that happens usually after a fall in someone that has had a previous, usually a hip or a knee replacement. Periprosthetic fractures usually happen in one of two time periods. It happens either right after someone has had a hip or a knee replacement and they sustain a fall before their implant has either fully grown in and gained full stability, or it happens in someone that has had a hip or knee replacement for many years that has been functioning really well and they sustained a fall and then had a fracture.
How does a periprosthetic fracture differ from a typical bone fracture?
A periprosthetic fracture, usually around our hip or knee replacement, differs from a regular bone fracture because as the surgeon, we have to take into account a prosthesis being there in the first place, and that usually guides management.
What are the most common causes or risk factors for a periprosthetic fracture?
The most common cause of a periprosthetic fracture around an implant is from a fall. The most common causes of falls are people that have balance or trouble walking or having a recent surgery or taking medications that make them more drowsy and put them at a higher chance of falls. In general, risk factors for periprosthetic fractures rely around bone quality. So people who have a history or a diagnosis of osteopenia or osteoporosis are more likely to sustain a periprosthetic fracture.
How can a patient recognize symptoms of a fracture after joint replacement?
Usually you'd be able to recognize a periprosthetic fracture, especially the ones that are more severe, when after a fall, you aren't able to get back up and walk. Sometimes you might hear a pop that might happen and you might have a limp afterwards and still be able to walk, but with greater difficulty than you did before. If that happens, then come and see us or head to your local emergency room to get taken care of.
What are the typical treatment options and when is surgery necessary?
Periprosthetic fractures can be treated with or without surgery. The type of fractures that can be treated without surgery, we take a look at two things. We take a look at your bone and see where the fracture occurred and see if it involves any of the weight-bearing portions of the bone. We also take a look at your implant and see if the implant is still stable or unstable. If the bone is unstable or the implant is unstable, most likely you need surgery for revision. If the implant is unstable and the bone is fractured, then we have to take care of both problems at the same time. Often that involves revising your implant to one that provides fixation further down the bone to give you stability.
How do you approach recovery and rehabilitation for older adults after this type of fracture?
Rehabilitation of a periprosthetic fracture really depends on the type of fracture. If it's a stable fracture that didn't need surgery, it might be a period of limited weight bearing and you working with a therapist and using a walker for a short period of time and then advancing to normal weight bearing. If you needed surgery, the weight bearing restrictions after will usually just depend on the type of surgery that was performed. Most of the time our goal is to achieve an implant and fixation that is sturdy for you to put weight on it. Most likely you will need a walker for your recovery period, most likely just to prevent falls.